This facility was kind of a dream that I had, and the idea was to have an all-encompassing center where you had from stem to stern. You could see the patient, they would see the physician. If they needed physical therapy, the therapy would be on site. There would be specialists in the field of therapy focused on whatever their issue was, whether it be a knee injury, a shoulder injury. And then if they needed bracing, we have on-site orthotists who could brace the patient, the athlete, so that they didn't have to go somewhere else, and that the doctor could communicate directly with the physical therapist, the orthotist. And then the dream was to have a performance center, to have something in the back where you could take an athlete who had finished their physical therapy and wanted to enhance their athletic performance, avoid future injuries. And the performance center was kind of the biggest part of the dream. It takes you again from stem to stern. It takes you from the injured athlete to the athlete who's now beyond that injury and now whose goal is to maximize their performance and prevent further injury down the road.
I'm a licensed athletic trainer and clinical director here at the Institute for Athletic Medicine and Physical Therapy. We are an outpatient physical therapy clinic connected directly to Dr. John Samani's Institute for Athletic Medicine, in which we treat all patients that come through our doors with all various types of injuries. We see operative patients, patients that undergo surgeries for various knee and shoulder injuries, as well as other injuries that pertain to the ankle, knee, and other joints of the body.
One of our goals of this practice is to treat each patient based on an individualized plan that we can tailor according to their needs and not based on patterns. We try to put a lot of focus on individualizing those services based on what each patient needs, and we take great pride in that.
One of the things that we've learned to offer are many different kinds of things that can be injected, some of which are traditional things: steroid, long-acting steroids, viscosupplements, which is also known as hyaluronic acid. It's a thick gel that you can inject into an arthritic joint. It's almost like putting jumper cables on something and enhancing the healing 5 to 10-fold. Some of these treatments that we're discussing, these orthobiologics, are not covered by insurance. So another goal is to provide these things to the patient at a cost-effective rate so that cost doesn't prohibit them from having access to the same treatment that the NBA basketball players have or the NFL football players have. And I think we've done that.
We have availability to do same-day MRI. We have short wait times to get you into physical therapy as well. So it's something special when you can have a patient walk through the door with a walker, with crutches, wearing a sling, and within a few days, weeks, be able to see them progress until eventually they're back to their full pre-injury state, especially with our facility being able to take somebody out into our gym and be able to fully assess how somebody's doing.
We have two of the most wonderful receptionists who understand billing issues, which are very complicated in this day and age. They understand people's time, they understand the value of trying to get a patient seen. I have a manager right now that is unbelievable. When there's a problem with patients, whether it be billing or concerns about the wait, she is an expert at customer service. So that's the arc that you speak of, where they come in, are greeted by professional, kind people. They meet informative assistants who are efficient in what they do. They get to spend time with the physician or the physician's assistant, understand their diagnosis, have things pointed out on models and in books and on posters. So when they leave, they just haven't had terminology thrown at them, that they actually can understand what's going on. Then they walk out of the room feeling comfortable about heading off to therapy, heading off to surgery, heading to their orthotist, or heading back to the athletic field. And then knowing that the patients have a good enough relationship with you to come back to you with their other family members or to let you know how those patients are doing in their lives beyond their injury. That's the ultimate reward.